Hello, everyone. Welcome. Today, we're going to be looking at chapter 16 in your text, which covers diseases of the musculoskeletal system and the connective system. There's a lot of material in it, but I think most of it will make sense if you follow the instructions, follow the tabular. Um, a lot of codes, a lot of finer details, but if you think about it, it will all make sense. So let's take a look and get started. And again, this is chapter 16, covering diseases of the musculoskeletal system. Interestingly enough, the codes all begin with the letter M, M00 through M99. And again, what we want you to walk away with after watching these lectures is to look at how the chapter's organized, read the notes, meaning the notes in the tabular, and how seventh characters work, especially with pathologic and stress fractures. And by understanding all this, I think it will make your coding easier. You can see how the chapters laid out. M00 through MO2 is infectious disease. M04, autoinflammatory syndromes. M05 through M14, inflammatory polyarthropathies. M15 through 19, osteoarthritis. M20 through 25, other joint disorders, and so on. And again, there's some more of these. You can see M45 through 49, spondylopathies, something I love saying on a weekend, and M60 through 63, disorders of the muscles, M65 through 67, diseases of the synovium and the tendon, and so on. This is yet another chapter where understanding the terms is critically important. If you don't understand what they mean, you can't really code them. So let's move on. And again, other things, I'm not going to go through each and every single one, but I think especially if you're new to this, might be worth your time spending some time on this and the previous two slides so you completely understand all these things. A key component here is that these codes are specific. Many codes require you to identify the exact location and the side of the body. Back to laterality again. You'll see instructions to code related conditions separately or to list the underlying causes first. And there's no universal rule. This is another reason why you have to validate everything in the tabular. An example they give here is certain osteoporosis codes include fracture details and the patient's phase of care. So we'll get into that in a little bit. What an initial counter is, what the follow-up is, what the sequela is, and so on. And when we use the term external cause, those are things that are causing the condition, right? So it's, in other words, it's explaining how the injury happened. And there's guidance distinguishing infections that directly affect the joint from those that spread from another site. And why these things matter? Well, they matter because that's what's going to determine whether it's the correct code or not. And again, what you may want to do is go through and look up each of these code categories in your text so you understand these, right? M21.7, the site should correspond to the shorter limb. M66 defines the spontaneous rupture, and so on. Familiarize yourself with these code categories because there's a lot of these throughout this chapter. And the coding guidelines for this chapter reinforces the importance of identifying the exact site that's affected, whether it's bone or joint, as well as whether there are multiple sites involved. And you can see this with osteoarthritis. If you think about it, it's very common for somebody to have osteoarthritis in the knee and other sites. You'll need to also know their condition is acute, chronic, or recurring. Pathologic fractures in particular need very careful reading. And again, there are 7 characters, which we'll get into how these apply in just a little bit. Osteoporosis is an area that requires special attention. Codes without a current fracture fall under one category. Those with active fractures fall under another. And they're also included as guidance on multi-system inflammatory conditions. Keeping all these things straight is essential for the correct sequencing. And you may want to use those PDF guidelines and look at guideline 1.c.1.g.1.I or 1. You'll see it. And again, with this chapter, you need to be clear that there's a wide range of both acute and chronic disorders that involve the bones, the joints, the muscles, and the connective tissues, the disc, and so on. Many codes incorporate both site and laterality. If you understand the anatomy that's affected, this helps guide your code system. And to get a better idea of this, you may want to take a look at figure 16.1. Okay, pay special attention to this slide here about the 7th characters. Certain musculoskeletal codes, especially for pathologic or stress fractures, require a 7th character. This character tells us the encounter type, like whether a patient is being treated for the first time or is returning for follow-up care. A is the 7th character for the initial encounter for a fracture. And then we have D for subsequent encounter with routine healing. G is for subsequent encounter with delayed healing. K is subsequent encounter for a fracture with non-union. P is subsequent encounter or follow-up encounter for fracture with malunion. And S is for sequela. So what exactly do all these things mean? Well, A is used when the patient is receiving active treatment. This is surgery, this is casting, this is care that's given in the ER, right? The D, 7th character, is used when the patient is in routine healing and the patient's at a follow-up visit. So we really need to keep those clear and straight and not get that confused. Sometimes we don't have fractures healing normally. And 7th character G is used for delayed healing. K is used for non-union, right? So the two ends are not healing, right? And 7th character P is when there's a malunion. In other words, it's a union, there's connection between the two ends, the proximal and distal ends of the fracture, but they're not aligned correctly. Finally, we have S for sequela. This is always a fun one that a lot of people that are new to coding don't understand. So basically, this is a complication or something that arises as a direct result of a condition. We have these in other areas besides the musculoskeletal but this is the one that is very, very complicated, right? With strokes and other things, we can have active follow-up and sequela. The fractures, it gets a little bit more involved. So this is coded with the same code category as the original injury, but it's added to it, right? So it's got to be a seventh character. So if they're not seven characters in the code subcategory, that's when you would use the placeholder X. And we'll take a look at some of these later on in this chapter. And that's all I have for you. Come back for our next video lecture where we'll finish our discussion about coding conditions of the musculoskeletal system. Bye now.